Good afternoon, Chair Murkowski, Vice Chairman Schatz, and members of the committee. I'm Darrell LaRoche. I'm the Deputy Director for Management Operations at the Indian Health Service. Thank you for the opportunity to provide testimony on S.1058, the Southcentral Foundation Land Transfer Act of 2025, S.1055, the Indian Health Service Emergency Claims Parity Act, and S.699, the Purchase and Referred Care Improvement Act of 2025. If I may restate the mission of the Indian Health Service, which is to raise the physical, mental, social, and spiritual health of American Indians and Alaska Natives to the highest level. This mission is carried out in partnership with American Indian and Alaska Native communities. The first bill before the committee, S.2098, the Southcentral Foundation Land Transfer Act of 2025, would authorize the Secretary of Health and Human Services to transfer certain land in Anchorage, Alaska to the Southcentral Foundation by warranty deed without requiring consideration to the federal government. The bill would also require the conveyance to be completed as soon as practicable, but no later than 2 years after enactment. Additional details are included in my written statement. As you know, Chair Murkowski and members of the committee, Congress has considered similar legislation in previous years that mandated land transfers by warranty deed rather than by quitclaim deed, and the Department has the same concerns with S.2098. As noted in my written testimony, HHS has identified certain preferences, and with those concerns in mind, the Department supports the purpose of the bill to convey the property to Southcentral Foundation. S.1055 and S.699 both relate to the Indian Health Service Purchase Referred Care Program, the administration and the Department's goals to improve health outcomes for American families and protect patients from medical debt. Therefore, I think it is very important to note that patients are not liable for PRC costs under Section 222 of the Indian Healthcare Improvement Act, and patients should not be forced into collections because of the unpaid medical bills. The PRC Improvement Act seeks to address liability for payment of charges or costs associated with the provision of PRC services. It would require the Secretary of HHS to notify a PRC provider and any patient who receives PRC by IHS that the patient is not liable to any provider, debt collector, or any other persons for the payment of any charges or costs associated with the provision of the PRC services. It would further require the Secretary through IHS and in consultation with Indian tribes to establish and implement procedures to allow a patient that paid out of pocket for PRC authorized by IHS to be reimbursed by the IHS for that payment when the patient submits documentation to the IHS consistent with the procedures established under the PRC Improvement Act. Simply put, patients should not be expected to pay out of pocket for PRC authorized services consistent with the patient protections in Section 222. However, if a patient chooses to pay in anticipation of a reimbursement under the new subsection D of the PRC Improvement Act, the patient should be cautious not to pay before alternate resources are exhausted or in excess of the PRC rates. Thus, as drafted, the bill may cause additional uncertainty for patients seeking care. S.1055, the IHS Emergency Claims Parity Act, seeks to modify the notification requirements for emergency PRC services. The current time frame for non-elderly or disabled individuals' notifications must be within 72 hours per current PRC regulation. The only concern with the bill is flexibility. If there's ever a need to change the time frames for notification of treatment or admissions to more than 15 days, such would need to be an amendment to a statutory limitation if the bill were to be passed by Congress and signed into law. All things considered, the Department shares the same goals as the drafter to improve PRC program protect patients from medical debt, and ensure American Indians and Alaska Natives throughout Indian country have access to high quality and affordable care. We look forward to continuing our work with Congress on these bills, and as always, welcome the opportunity to provide technical assistance as requested by the committee or its members. Thank you again for this opportunity to testify.
Thank you, Mr. LaRoche. We next turn to Dayna Seymour. Welcome.